So for those of you that don't know, I'm currently training for a marathon, and about halfway through my training, when I got to my long runs at about mile 14, I started to experience what some people might call sciatica. Now, this is sort of a touch-all term, umbrella term for symptoms of a back structure that are referred down your leg. Now, this brings up a really good point because I'm telling my patients about this because they are aware that I'm obviously training for this, and I'm telling them my struggles. And some of them are coming at me like, well, what are you doing about it? What would you tell me if I was experiencing this? You'd tell me to stop. And well, maybe initially, but that's not the full story. What pain is, it's an output of all the inputs that we go throughout our day. And what it wants us to do is address that symptom in some way. And while stopping is important in the short term, it's really only important to do if you're not addressing the problem. So utilize the stop to modify and start to work towards whatever is causing your symptoms. And now if you don't have the correct knowledge or know how to do this, then it's time to seek out another healthcare provider. And I give people 2 weeks. You have 2 weeks to suffer on your own, suck up your ego. If it's been more than 2 weeks, go see a physical therapist. Now, here's the kicker. I'm a physical therapist, I'm a doctor of physical therapy, and I tried to address my symptoms for 2 months. I know I didn't follow my own advice, but I did try. I tried to address things on my own. And then I got to a point where I had tried everything I could. I was making some improvements, but they weren't getting any better on my long run. Now let me explain that a little more. My symptoms were going further and further down my legs, a concept that we call peripheralization, whereas I want them to go further and further up my leg, back up to the back, and that's called centralization. This is a concept of the symptoms moving closer to the source of where the whole origin of the problem lies. Now, my symptoms are seemingly very neural. They feel tight, string-like, kind of following the pathway of the sciatic nerve down my leg. So I tried nerve glides, I tried more cardio. From the bike actually helped because the hamstring runs along the back of the sciatic nerve, the back of the thigh, and the biking used the quad more, the front of the thigh, and that seemed to equalize out the pressure, and that helped for a little bit. But as I increased my mileage, so then did the stress of the running increase, and it just wasn't enough to continue cardio and in a biking fashion. So what I eventually did was seek out one of my colleagues who practices PRI, Postural Restoration Institute. It's a more specialized perspective from, again, a very biomechanical lens that I just don't take. And perhaps after this experience, I might try and integrate this a little bit more because I see the benefits for myself. It's another tool in the toolbox, and her name is Courtney Warren. So this has been helping me, focusing on my breath. We think that the problem lies more in my rib cage. My rib cage is not expanding and contracting with my breath. I'm actually having to use my upper traps in order to create space for those lungs to expand. And that's not how the lungs and the rib cage should work. And this creates problems downstream on the load-bearing structures of the low back. That's why I'm getting symptoms down my legs. So, to all my patients out there, I am changing my symptoms. They are getting better. I am addressing them, but just in a more nuanced way than going to my doctor and getting some pills. There is a time and place for that, but I know that my symptoms are an output and not just something to be feared because they're new.